Hi everyone, my name is Buhle from Legal&Tax, and welcome to our COVID-19 info session. The reason why we decided to host this session is because we've received a lot of feedback from people who have questions about COVID-19, or who maybe are too scared to ask questions because of the stigma associated with this virus. And that definitely shouldn't be the case. And as a companion, we definitely want to try and debunk some of these myths and get you the real answers. I'm joined today by Dr. Avron Urison. Welcome, Doctor. Thank you so much for joining us.
Hi, Buhle. Lovely to be here today.
So firstly, let's start by understanding some of the terminology associated with COVID-19. Some people refer to it as coronavirus, and some as COVID-19. What is the difference, Doctor?
So, Buhle, coronaviruses, it is really a whole group of viruses, and they've been around for quite some time. And some are totally asymptomatic in the population, some can cause a common cold, and some of these viruses can lead to more severe illnesses. The novel coronavirus that we're talking about it causes the disease COVID-19. So COVID-19 actually refers to the specific disease entity that we are experiencing now in the pandemic, and that is caused by a specific type of coronavirus, and that is the coronavirus we test for and monitor in this pandemic.
And experts call this a pandemic. Can you explain to us what the difference is between an epidemic and a pandemic?
So an epidemic is a large outbreak of infection, but it's confined to a particular area. Once it actually spreads into multiple territories around the world, then it obviously the infection becomes much more spread and actually infections in many countries, and then it becomes a pandemic. The short answer there is epidemic is localized, confined, pandemic is actually spread through numerous territories. And that's actually what we're experiencing now, because the coronavirus, which is causing COVID-19, as we explained, has gone through multiple territories and countries around the world. The World Health Organization declared it as a pandemic.
And the last major worldwide pandemic was the Spanish flu back in 1918. What causes a disease to become a pandemic?
So that would be if it's a highly infectious virus. A highly infectious virus that can cause significant disease would cause a pandemic or epidemic and then a pandemic. Yes, the Spanish flu, which caused millions of deaths, as we know, in 1918 and went through multiple waves, that was probably our last significant pandemic. And now we have this novel coronavirus causing COVID-19, a highly infectious virus spreading around the world, and hence we actually have a pandemic. And as we know, it has no boundaries, it has no locality, and it's easily infectious from one human being to another, and hence we have a pandemic that's been developed.
And we've also been hearing COVID-19 being compared to a common cold or even flu. Some say it's similar to pneumonia. Can you explain to us, Doctor, what is COVID-19 and how serious is it?
So I think we need to clear this misconception. In the early days when coronavirus, when we heard it started becoming an epidemic and then a pandemic, a lot of people and a lot of social media sites, and even in some literature, they said, well, it's very much like a flu and it's spreading around. But the truth is, we can't fall into that trap to say that, because there's a bit of danger there. And the reason that is that it's a much more highly infectious virus. So yes, flu, we have a seasonal flu, and that goes around, and it does have a level of morbidity and mortality, which could be more significant than COVID or coronavirus. But COVID and coronavirus is a much more infectious virus, and therefore it can infect many more people, and there on a country and global scale, many more people can get sick and land up dying. So we should not compare it to the flu. Some of the symptoms, and we'll talk a bit about the symptoms, may be similar to a cold or a flu or a pneumonia, but it's a different virus. It's a different viral infection, and it has a different pathophysiology, and will actually have a different ways of treating it in the severe forms.